Okay, welcome everyone. Good morning, good afternoon, or good evening, depending on where you're calling in from. I'm happy to welcome you to this webinar on GS1 standards in healthcare. It's something that is predominant now and important to supply chains everywhere. And so we have three great panelists with us today. Before that, I'll just say that for those of you who are still joining, welcome, and again, this will be recorded, and you'll see that. So let's start by introducing the panelists and myself. So I'm Walter Proper, and the Executive Director for IAPHL, and I've been working in this field for a very long time. That gave me a white beard, and I've managed supply chain projects throughout Africa. And then for our panelists, our first panelist is going to be Nuran Idris, who currently works as the healthcare manager for GS1 Global Office. And her main role involves supporting countries in Africa on their quest to set up pharmaceutical traceability using GS1. And then before she joined GS1 in 2020, she worked in various public health supply chains for about 10 years. And as you will soon see, she's very passionate about harnessing the power of technology, global standards to improving health commodity supply chains, thus contributing directly to patient safety. Our next panelist will be Al Sharifa, who is the Deputy Chief of Party and Technical Director for USAID's Digital Health Activity, which is the primary digital health project by USAID to assist the Ethiopian government in its digital transformation of the health sector. He also serves as the principal representative for JSI's technology teams, providing Ethiopia products with overall guidance in all aspects of digital health and information technology, including management assistance, technical support, and strategic advice. And then our third panelist is Haley Traeger, who currently leads the Global Standards and Traceability team within the SC-PSM project. And this team supports the project's efforts to implement standards-based identifiers, data carriers, master data exchange for USAID-funded projects, and supports the implementation of traceability initiatives in national supply chain programs. And this role builds on her previous experience with donor-supported supply chain operations and strategy development. She worked for the United Nations and the United States government, and has been focused on product quality management, supplier relationship management, data management, and interagency collaboration. So I think we have some great panelists, and hopefully we'll all get something out of this webinar. So next, just to say, if you have questions, there is a Q&A box at the end, as you'll see, and put your questions in. And at the end of the webinar, we will try to answer all your questions. If we should run out of time, which I don't think we will, then we will follow up on the listserv and make sure all questions are answered for you. So without further ado, I turn this over to Nuran.
Super. Thank you very much, Walter. Good morning, good afternoon, good evening, everybody. Buen dia. I hope you're well. Since it's still January, I also say Happy New Year to everybody. I think we all hope it's a great year, better year. Like Walter mentioned, I work with GS1 Global Office. I'm actually based in Nairobi, Kenya. And I work with countries in Africa, specifically on GS1 healthcare. So over the next few minutes, 10, 15 minutes, hopefully, I will try to condense a training that usually takes multiple days, but hopefully at the end of that, you will be able to understand at a high level what GS1 standards are, and hopefully that will also help you understand the content that will be shared by my other colleagues that are also on the call. So I'd like to start with a familiar point. The supply chain logisticians in the room, probably you're all familiar with the 6 logistics rights. And I like to think of them as encompassing the entire supply chain from the beginning to end, from the time the product is manufactured up until the time it gets to the patient. Now, the one right that I think really resonates with specifically within with GS1 standards is the right good. So what exactly do we mean, or how do we ensure that the patient, the customer that we're issuing a medication to is actually receiving the right product? What exactly does right product mean? When we talk about end-to-end traceability, which I know is a conversation that is existing in many countries that are either represented here in many countries around the world, we want to make sure that we are securing where we have visibility of the product from the time it's manufactured up until the time it gets to the patient. Now, there's different versions of it, there's different definitions of it, but the version of end-to-end traceability that I'm talking about is exactly the one that I've probably already mentioned 3 or 4 times already. And that means that we want to have visibility, we want to be able to trace a product from the time it is manufactured to the time it gets into the hands of the patient. So we want to make sure exactly, well, again, in the context of the right product, we want to make sure that at the end of the supply chain, at the other end of the supply chain, when the patient is receiving the product, they're not receiving a counterfeit product. They're not receiving a product that is falsified. I think the correct term that WHO authorizes, recommends to us to use is substandard and falsified. So we want to make sure that by the time the patient is receiving the product, they're not receiving a substandard or falsified medicine. Instead, that they're receiving the actual product that the box says, right? So if the patient is supposed to be receiving, or if you are issuing a product to your customer that says that product is product X, manufactured in this location by that manufacturer, that it is indeed that one. So many words to really talk about the end-to-end traceability and the right product. So what exactly is GS1 as an organization? So GS1 is a neutral, not-for-profit standards development organization that is driven by its users. So it means that the standards that are managed within GS1, that are developed with the leadership of GS1, are not developed just by GS1 itself, but in fact, we have representatives from the entire supply chain who come together to develop these standards. So that means they are developed by the users. So we have, for instance, a manufacturer would be sitting there. We have a third-party logistics provider. We have representatives from the hospitals, etc. So they are the ones who are actually involved in the supply chain process, in the business process. And so it actually makes sense for them to actually come to the table when we're talking about standardizations and whatnot. So GS1 is a global organization, again, for the maybe 3rd time already. And what you see on the screen are some interesting metrics that really just help you to understand how vast it is. An example I like to share, we usually like to share from GS1, is the beep that we hear at the supermarkets or grocery store, depending on how you call it. So you go to the grocery store and, you know, the checkout at the checkout counter, whoever it is that's there, you hear the word beep, you hear the sound beep, beep, beep. And that beep, beep, beep as the product is being scanned, that is GS1 in action. GS1 has standards that enable you to, and that's actually captured in the next slide. GS1 standards enable you to identify, capture, and share. And so these are the 3 terms that I would, you know, if there's one thing I'd like you to take away and to think about next time you think about GS1 standards, is that these standards enable users to uniquely identify, capture, and share. So what exactly do we mean? What are we talking about? Identify, what exactly capture and share? So let's start with identify. When we think about the supply chain, right, you have various entities there, you have various, and that's on the next slide, you have various stakeholders there, you have various things that are involved. So what you can see on the screen, on one hand, you have the manufacturer, you have the product, you have the truck that is actually shipping the product from one location to another, you have the hospital, and etc. And on the other side, I don't know if that's right or left, you have the patient. So the GS1 Identify Standards enable you to uniquely identify the various entities. So we have a standard, we at GS1 have a standard that help you to uniquely identify the various entities that you have in the supply chain. And excuse me again that there are many acronyms here. I will try not to speak in acronyms, but hopefully you can also see on the screen here some elaborations on some of them. So just as an example, we have something called GTN. And GTN is the most popular GS1 standard, most familiar. GTN stands for Global Trade Item Number, and that stands to uniquely identify the product. Then we have a GLN that uniquely identifies the locations, global location number, that's GLN. And then we have a few others. On the other side, we have GSRN, Global Service Relation Number, that has been used to identify patients, service providers. So think about the doctor, think about the pharmacist, the warehouse manager, etc. They can all be uniquely identified within the GS1 system using something called the GSRN, that's Global Service Relation Number. I'd like to remind you again, if there's any questions, please put them in the chat. I know all of this is could be new for some of you, so do not hesitate, ask any questions, put them in the chat, and we will get them to them later. And then moving on to the GS1 Capture Standards. Again, in simple terms, I'm sure you've seen a barcode again. That you have, again, going to the earlier example that I talked about earlier, the supermarket, grocery store. When you go there, you have the checkout counter. Either you or the customer relation person there would be scanning the barcode. And so GS1 develops standards on how those barcodes or the information that is identified that I just talked about, the GLNs, the GTNs, the GSRN, etc. How that, so we develop standards on how that information can be uniquely captured in a barcode such that whenever that information needs to be accessed, it is not a question of manually typing in that information to retrieve that information. Rather, it becomes a question of just scanning and then you retrieve that information. So let's just take an example. We have a GTN, a Global Trade Item Number, that has 14 digits. So if it's just one product, you might think, okay, yeah, you can actually capture one product manually in your system, and then that's no biggie. But then if you have 10 products, if you have 20 products, if you have 100 products, manually capturing that information from the box increases a really highly risk of error. It's tiring, it takes time, and these are just some of the issues that you would come across, just really thinking from the top of my head. So what we do with the barcodes, with the different barcodes, is that it actually captures the same information in a barcode format so that when you need to retrieve it, you just scan. Now, what you can see on your screen here is just some of the different kinds of barcodes, which may look like the same barcode, or maybe you might think there's maybe one or two different barcodes there, but in fact, there's quite a few. I'd like to bring your attention to two, which have been a point of a lot of conversation, a lot of discussion, again, for many stakeholders whom we have been speaking with, and that's the QR code and the data metrics. And those are, there's one under patient caregiver, and then there's another under item. So the GS1 data matrix is the one that we use to track, that is the one that we use specifically within healthcare. It's obviously also used in other different sectors as well, but within healthcare, that is the one that is the one we use. So do not confuse the GS1 data matrix with the QR code. The GS1 data matrix is the one that we're currently using, and I'll talk a little bit more about this later. So we also have a GS1 128 as another barcode. We also have EPC RFID. So I don't want you to remember all of this. All I need you to remember is that GS1 develops standards on how information can be uniquely captured in a barcode, and then that that process of uniquely capturing this information in a barcode ultimately simplifies the process where the product will be used. And then finally, GS1 Share Standards. GS1 also develops standards on how information about the product can be shared systematically across the various supply chain stakeholders. So we have quite a few standards here, but the most popular one are GDSN, Global Data Synchronization Network, and EPCIS. which is also used to transfer information, traceability information as the product is moving. So again, these are entire trainings which take, takes at least an hour or a few hours. So just at a high level, again, just remember, keep in mind that GS1 develops standards that enable users to identify various supply chain entities, capture that information in barcodes, and share that information systematically. So why do we need global standards? And that's what we talk about in the next slide. So let's take a look at this example. So you see the machine over there, that represents a manufacturer. So think about a manufacturer. And this is actually, we have a quote there from one of the manufacturing companies. And you have a manufacturer, and they have requirements. Again, the example we have here, we have 5 countries, and imagine that this manufacturer has to put a different type of barcode on every single on every product, or maybe on the same product that is going to different countries. That means they're taking a lot of time, and then it also costs. Time is also money, as is popularly said. So what we're trying to avoid is having the manufacturer only have one set of standards that they can actually apply and use that that information can actually be used regardless of which country that product in. Obviously, that product is going to be used in. Obviously, there are going to be maybe groups of countries that have similar requirements, but definitely when we talk about pharmaceutical traceability, there is a move really around the world, and I get into a bit more detail about that on the next slide, where we're recommending to have, and this is a global trend, we're recommending to have, and when I talk about we, I must clarify that it's not just GS1, but this is a stance of the GS1 healthcare team, which is comprised again of different manufacturers, third-party logistics provider, hospitals, member organizations from GS1, etc. And collectively, we recommend that, and many countries are already following this trend. Products, when we're talking about pharmaceutical traceability, products the information that you see on the screen here. So that's the global trade item number, serial number, expiry date, and batch number would be captured in a GS1 data matrix. And that's the type of barcode that you can see on your screen here. So again, the trend that we have right now, the global trend, is that the information that you see on the screen here, the 4 pieces of information, would be captured in a GS1 data matrix, and then that information would be used regardless of where you are. And then on the next slide, I give you a high-level idea about where exactly, what exactly do I mean. I think it elaborates rather when the term trend. So where you see green, it means that the countries are using or are currently accepting GS1 standards and following the trend that I just talked about briefly earlier. As you can see in Africa, there's still quite some work that is to be done, that is being done. And while there's only a few countries in Africa that currently accept GS1 standards, there's many more that are actually having conversations about GS1 standards. So if we were to also have maybe another country, another color code, maybe that's also for next time, we would see where there's actually active conversations moving towards green. So I suspect perhaps maybe in the next 2 or so years, we will see many more countries in Africa with the green, meaning that they use GS1 standards to support pharmaceutical traceability in their respective countries. And then I finish with some of the benefits that these countries have actually seen when we talk about GS1 standards. And then again, end-to-end visibility. Again, we have multiple examples from across the world that have demonstrated end-to-end visibility, ability to be able to track, to see the product, to verify that the product has actually moved from the manufacturing site to a distribution site to that location and ultimately gotten to that location up until the time it gets to the patient. So this is tried and tested. Turkey comes to mind as a country that I could mention around the world, that many countries around the world are looking to for inspiration, because Turkey has actually implemented already end-to-end traceability, but also, of course, there's many countries, many hospitals also that have that. But most importantly, there is a reduced risk of counterfeit medication. So that means that the products that are, because of this end-to-end visibility, the risk of counterfeit medications entering these supply chains has diminished by a great deal. Obviously, it's still a challenge that still exists all over the world, but nonetheless, that's one of the main benefits that has been noted in all these countries, but also contributed to many supply chain efficiencies. And the most important one really is patient safety. So that's me. Hopefully the next speaker will be able to elaborate on some of the points that I talked about. Over to you, Al.
Thank you, Nuran. So so we've had a great presentation, and as Nuran's challenge is to take what takes hours and put it into a very short period of time for this webinar. So as Nuran said, we are going to move now to an actual country perspective in an African country. And Al's going to talk about some real life experience of what all this means within a country. So Al.
Thank you, Nuran, for that wonderful presentation, and Walter. So my name is Al Shufaro. I work with JSI based in Ethiopia. I'm the Deputy Chief of Party and Technical Director for the USAID Digital Health Activity Project. So our project focus is exclusively focused on digital health. So a big portfolio we have is in supply chain as well as other areas of work. And we've been doing a lot of GS1 work and traceability for some time. So happy to share with everyone here. Next slide, please. So I believe most of you know the context of Ethiopia, but just kind of throw in some numbers on the background. So that's our second largest country in the sub-Saharan Africa, about 110 million people. In terms of health commodities, and I'll mention this as we go on different slides, about 21,000 unique commodities categorized by pharmaceutical supplies, equipment, and so on, and about 23,000 health centers and hospitals and so on. And we got a huge number of imports, as you can see on this slide, and about 850 unique suppliers that are involved in importing medicines to the country. They're not necessarily all private, but including NGOs, international institutions, and so on. And we run about $160 million worth of drugs from local importers. Next slide, please. So the Pharmaceutical Products Traceability Directive, which is one of the core messages that we like to share from the country experience, is as a multi-phase process. So this was not something that we did overnight, and I think most of you focused on this type of work across the country will find that it is a multi-year long, maybe even a decade-long process to make it for it to make it work. So in the first phase, focus was on identifying unique identification and labeling requirements. As Nuran went through the slides, as you can imagine, how much detail it goes into all of those small boxes. And you all remember that she said she's trying to compress a number of days and weeks of lessons in about hours. So there's a huge number of variations or requirements and exceptions on how products can be labeled, how they're labeled in boxes or in bottles or in strips and so on. So all that thing has to be discussed within a number of stakeholders we've been able to set up within the country. So Ethiopia has a very strong governance system, and one of the early adopters of GS1 in Africa was Ethiopia. So headed by then the minister, and then being now led by the Ethiopian Food and Drug Administration, which houses the ownership of this directive. So the second and most important thing is standardizing the master product data and location information, starting with master product. If you don't get phase one, you can't get phase two. And I know a lot of you, especially within this group, know how complex pharmaceuticals are when it comes to, it's much easier than said than done, but how much is easier, how difficult it is to be able to identify them, to get the right syntax going, and then having that product product list to be a master product list, which means getting acceptance across the different stakeholders. So the private importers, as well as the huge government central medical store, what we call EPSA in Ethiopia, as well as other organizations, including, say, UNICEF and so on, which also run a huge number of products on their own. So another decision that we made as we were trying to move between phase 2 and phase 3 is being able to test the system through batch itself. So GS1 introduces a whole lot of layers and complexities that are essential to be able to provide full traceability, and full traceability is something that we hope to achieve, as a process. I don't think any country or anyone can tell you that they have implemented a full traceability. That's not going to be accurate. So in our case, we try to see how much of the traceability that we can apply within the batch tracking system using the existing MI systems that we have at the central medical store in EPSA, as well as the branch, and then the various hospitals and health centers where we have an inventory management system automated across the process. And then the fourth phase is sterilization and traceability of unique items. As Nuran described, the G10 provides the uniqueness of the product, whereas the sterilization provides uniqueness on that specific physical bottle or carton or strip and so on. So that's the ultimate goal. Unfortunately, we're starting to see a much, much faster adoption from the manufacturers in not just G10 from what we saw about 5-6 years ago to what we're seeing most recently, especially with HIV commodities, essentially all of them coming with sterilized G10s, and barcodes are GS1 compliant. So giving us a much greater hope that we can achieve this target much sooner than we initially planned. Next slide. So focusing on the traceability roadmap, before we even can write a brief paragraph, somebody had to sit down and figure out what we wanted the roadmap to include. So focusing on who we needed to define as an audience, what the scope might be, the packaging level requirements, traceability systems, and so on. So for the audience, so when we think about a full scale of traceability, this is really where you get into having your manufacturers engaged, your procurement suppliers, in the case of Ethiopia, pharmaceutical companies are not allowed to sell directly to the country. So we have to engage with the importers and suppliers as I showed you on the very first introductory site, all the way down to the health providers and the facilities that provide the dispensing to the patient. So it could be in the form of a pharmacy, or it could be in as an IPD or IPD service. So with scope, I talked about 21,000 unique products, but in Ethiopia, we're focused on pharmaceuticals. In general, a lot of the tracing is focused on pharmaceuticals. We can take more questions towards the end. This by itself is a huge feat, so not easy to, even though in numbers wise, we are focused on one group, or it appears that may be excluding a large number. This is a huge task on its own. In terms of packaging levels, again, if you can kind of go back in your memory on the previous slides from Nuran and GS1, is we had to define what level of tracking that we want to provide. So you want to do it at the secondary level, you want to do it at the tertiary level, as well as the primary level. So in our case, our primary focus on packaging is applying primarily on the secondary level packaging and as needed on primary packages. There's some exceptions. GS1, you're not going to find GS1 labeling for the most part on primary packages. Some minor exceptions, with very few on COVID vaccines. None of those that we found or received in Ethiopia had primary level G10 assigned on them. So the lowest unit that we can find GS1 packaging, and that's normal, that's expected, is on the secondary stage, sterilized. Last, traceability system. So we understand that this is going to take time. So gradual implementation, as I described earlier on phase 3, the different phases and encompassing various levels of traceability. So, track and trace and verification. We believe that a very good and easy introduction to the whole system was through verification. And we have a product that we use currently live on the Google Play Store that the public can use to be able to do verification of commodities. Next slide. So a big lesson, a lot of times we end up starting with technology, and that is a fast way to lose because without it being supported by policy and guidance and a very strong, clearly defined directives, very difficult to go much further. So a whole lot of work was done actually in support as well with GS1 headquarters and consultation with a number of countries and looking at various directives that we can pull from various countries which have already implemented similar directives prior to us. So the primary focus is protect in public falsified, standardized, and registered expired medicines. As Nuran mentioned this, I won't go too much on it. But also focused on efficiency in the pharmaceutical supply chain regulation. This basically upgrades the overall LMIS supply chain management work that the country has into a much higher standard. And number 3, to develop a system in which identification, authentication, traceability is guaranteed from the point of initiation, from the manufacturer sending us their advanced shipping notices to when it's received at the various ports in the country, whether it's dry or air, and then as it passes through the supply chain system, so hospitals, or retail outlets like pharmacies around town, and then eventually down to the dispensary. And the last is to enforce mandatory requirements and implementation of identification and authentication, and a whole lot that goes into this. And the reason being that maturity level of every stakeholder from the point of the procurement agent to the manufacturer to even the shipping service providers, the companies that provide the storage and distribution, the pharmacies, is going to vary tremendously. Well, and that's almost like an understatement. So a lot of work that we have to do to go out of our way to provide a number of sessions, to sensitization sessions, to get the message across and demonstrate how this work to bring all of them aboard. And it's not a process that's over. We continually are doing that right now within the HA project here, along with the Food and Drug Administration, and eventually, you start to get the early adopters, and then more and more will fall in play. Next slide, please. So now we've talked about the directives and the policy behind it. We were also working on the technology side in parallel. So a lot of the boxes that you see here are MIS systems. So essentially applications that sit at various processes of the supply chain management regulatory information system. Not all of it is within the supply chain management. I think one of the first lessons learned was that a lot of people assume that traceability begins at the central medical store, but in many cases, in fact, in almost all cases, it doesn't. It should start with the regulatory component. So starting on the left side, center left, with the I license. So we have a system in Ethiopia that we've digitized to provide licenses for importers, local manufacturers, wholesalers. We also have another huge system. In fact, it's one of the most complex that provides market authorization, where those licensed agents come into the system and register their products. And we collect G10 information if it's available, not always available at time of registration, but in some cases that it is. So this is the first contact that we have with the GS1 system. And then once products, let me back a little bit. So once a product has been authorized for a market, we take a collection of those lists and throw them in our database, the National Product Catalog. The reason that we have the National Product Catalog separate than the iRegister system is because, unlike the iRegister system, which is an internal product of the Ethiopian Food and Drug Administration, or the various FDAs that you will have across different countries, the MPC is going to be a shared resource, and that's a key word I like to emphasize, a shared resource to be used not just by the Food and Drug Administration, but also by the Central Medical Store, the private suppliers, NGOs, international vendors, and so on. So that is where you would go to know what the country has defined as its master product, what's authorized, the permission that's been given to have that product imported in the country within a certain period of time, and so on. So once products have been, a vendor or the government of Ethiopia has decides to import a product, they have to go through a system, what we call iImport. Ethiopia is slightly unique in other countries where we require a process where importers do give the government a notice of what they're about to import. We do this for a number of reasons, including a letter of credit, foreign currency issues. The huge advantage here is that we will know ahead of time not only what's coming to the country, we even know what's about to come to the country. Now, it doesn't necessarily mean just because somebody has put in a request for import, they may not necessarily execute on that approval, but it gives us a whole lot of insight. And because this is an audience that's focused on supply chain, as many of you know, say when it comes to family planning commodities, we tend to have a lot of information of family planning products that are being imported by donors or partners, and we'd skip and not necessarily have insight into what the private sector might bring in, which, even though albeit it might be a small sector. Because of this requirement is for everybody, we do get that visibility to what's coming to the country. And then the middle circle that you see pre-shipment is really where we get a majority of the GS1 information. I want to be very careful to say that. I'm not saying we're getting it for everything right now. This is the whole lot of effort that needs to go in. And remember the maturity level that I talked to you about earlier. So it all depends on the ability of your suppliers, the ability of the manufacturer to be able to have a digital system, an MI system that can properly package and format those records, the packaging list, the shipping documents, expiries, batch, GTINs, and so on, into machine readable product file. So it does not serve that this comes in the form of a paper. It also does not serve the purpose if it's just a paper that's scanned and sent as a PDF. It needs to be in a format that we can process and directly feed into the overall traceability system. And last but not least is because we have and we continue to get and will information of what's coming to the country from the pre-shipment process, we are able to ensure that the products that are arriving at our ports are the very same products that were said to be arriving based on the data we've received on the pre-shipment stage. And with a various number of barcodes, SCCC, which is basically layers of containers of the products, and then the barcodes will be able to verify, but just by scanning what's contained in those pallets or in those tertiary boxes, and ensure that not just the same product is being received, but the same exact product in the case of sterilized agents. In order to support all this, you notice that one of the approaches that we were going with in different stages. So we're starting with verification. So we have a mobile app that connects to the entire data set here that you see here at the top, says National Traceability System. So the public will be able to either scan or search for medicine and be able to know who has been registered, just to go back now, who the official authority is who's been allowed to import the product to the country, when they registered it, when the expiry, the registration expires, when they got their import permits, the different shipments that's coming, the pre-shipment information, as well as when the product has cleared. We believe this is not just a functionality to provide information, but as you can imagine, it's also plays a role as a deterrent. I think, when people know, or people who falsify or engage in behaviors that we do not want, they know that the public is more engaged, it's going to be very difficult to pass those products over to the public. Next slide, please. So this is zooming further, and so you can see the broader goal as a nation. So on the bottom left, on the top left, so I'm sorry, on the top left is the very same slide in a more compressed fashion than as you saw on the previous screen. But this is what's showing you all the different actors, players, and stakeholders in play. So on the top right, you see the procurer and wholesaler. We carefully called procurer because, again, it's not just a central medical store. You have so many different buyers that are active in stakeholders into this, as well as the hub and the warehouses that work under the central medical store. And then below that, obviously, we have the health facilities, hospitals, health centers, some cases health posts. But it's not just health facilities. We all know in many cases in Africa, the districts also play a role, as makeshift role as a supply chain channel, sort of an informal warehousing service is provided in most cases. In Ethiopia, we use them a lot for malaria. In fact, EPI vaccines are stored at the district level for cold chain purposes. So your national traceability system cannot just be, just like I said earlier, that your national traceability system does not start at the CMS. It doesn't also end with the Food and Drug Administration. So everybody is feeding in that information. So from the EFD, the Ethiopian Food and Drug Administration side, the FDA side on the top left, you get a lot of the upstream information, what's registered, what's coming, what has arrived. And then on the right, from your procurers and wholesalers, you know what's actually in store, because we scan, and the idea is to be able to scan as you have events such as receipts, issues, transfers, damages, and also and so forth. And all that data is being stored into the central traceability database through the process. So from at the central medical store level, at the hub and warehouses, at the districts, hospitals, health centers throughout the health system, and the iVerify application picks that data from that centralized database where we only capture the events. So the transactional information of what happens within each process, whether it's on the registration side or market authorization, or the supply chain side, stays and housed within the local MI system. And then the event information is captured on the traceability side. We're working on a dashboard, track and trace dashboard portal, which also visualizes all the data elements and the events that we capture or end up in the traceability system. Next slide, please. I believe that's the last one. So just an implementation update, the strategic planning, that's one I showed you on the earlier slides. That's been completed. The master guideline, the master data guideline is also completed. So in terms of legislation, we do have the directive approved by the Attorney General Office. So that is on directive, but now we're getting a regulation in place, the Food and Drug Administration regulation. The data matrix barcode, this is less, obviously it's not legislation, it's a guideline to provide guidance for the different stakeholders. And then we're also looking at GLN rules. GLN is its own area focused on locations. And then in terms of functional governance structure, we have a traceability office housed within the EFDA. Then we're designing what that health human resource demand might be. Last but not least, this is not something that could be a project. This is something that's embedded, routine. It will have to be routine within the government system. So the EFDA is working on ensuring there's a dedicated budget to keep this business moving on a regular basis. I believe this is the last slide. Over to you, Walter.
Thank you, Al. So now we've had Nuran tell us about sort of the global project, what it wants to do, and what hopefully using GS1. Al brought us through many steps that Ethiopia is going through. Some have been accomplished, many still to go to make it successful on a country level. And now we're turning to Haley to really look at the global procurement experience and how GS1 fits into that. So over to Haley.
Thanks, Walter. So as Walter said at the top of the call, I currently lead our Global Standards and Traceability team at SC-PSM in our DC office. And as a quick introduction for anyone who may not be familiar with the project, on behalf of USAID, GHSC-PSM purchases and delivers health commodities that and supports system strengthening of national supply chains. And today I'm representing colleagues across the project that have worked under the technical direction of USAID to support an integrated approach in its journey to adopt and implement the standards that we've been hearing about in the previous two presentations. And if you go to the next slide, our support in this area roughly falls under three buckets. So starting from the bottom, supporting USAID and engaging with the global health community to build consensus and alignment around requirements of donors. The second bucket is on supporting governments and USAID supported countries to develop strategies and support implementation of global standards. And then that third bucket at the top is in our global supply chain operations, implementing standard product location identification, labeling, and master data synchronization for a set of products that are procured using USAID funding. And it's in that bucket of work that I'm going to focus for the next few minutes to complement really the perspective that we've seen from implementation at the countryside, talk a little bit more from a procurer side, what implementation has looked like. So if you go ahead to the next slide, this slide provides a summary of our supplier requirements that have been implemented over a phased approach in several years. I think that's another theme we've heard today is a phased approach. And the USAID began looking into the adoption of the standards for product identification, labeling, and data exchange around 2014, 2015. In 2017, we began integrating into our supplier contracts requirements that require suppliers to allocate G10s according to specified packaging levels, assign GLNs to specified locations, and encode these in specified data carriers that you'll see a bit on the next slide. And since 2017, we've learned a lot of lessons in terms of refining scope, and we've currently executed these requirements across more than 70 suppliers. I think the last point on this is really that this has prepared many of the suppliers for the regulatory requirements that are coming in many of the markets that we are shipping to, like Ethiopia, as Al was describing. If you want to go ahead to the next slide. This slide provides a visual overview of our labeling requirements for pharmaceuticals. And if it looks familiar, some of this information, it's because these have intentionally been designed to align with global trends in markets, align with the GS1 standards. And so these are harmonized, and we've also worked closely with stakeholders in the initial stages, including GS1, in the development of these requirements. And you can see from just a nuanced perspective, building on a couple of things that Al said, that the requirements are unique to the packaging level. The data carriers are unique to the packaging level. The information encoded in those data carriers is standard, with that last step being the sterilization to ready these products, both for use in our own supply chain, but also for regulatory requirements that are forthcoming. And then just being conscious of the time, we can go ahead and go to the last slide here, and I just want to spend a minute or two reflecting on some of the lessons learned since we began operationalizing these requirements for the products that we procure in 2017. So this slide highlights a number of these, what we have found has driven success in operationalizing the allocation of the identifiers, printing of the data carriers, and exchange of master data, specifically via GDSN, which is something that we do with our suppliers. I'm not going to go through all of these just for for time reasons, but rather I'll just highlight a few. So the first success driver was really providing the appropriate incentive structure that demonstrates clearly what the expectations are, and then how from an implicit and explicit perspective. So explicitly, these are contract requirements, but implicitly demonstrating how this is of mutual benefit to both parties for implementing. And this, again, aligns with what you're hearing from the countryside, and putting in place that policy and regulation being key for moving the needle. And from our different perspective, having the clear requirements in terms of contractual requirements and guidelines also being very important for establishing that foundational level to be able to operationalize this data in processes. The second success driver is really having the appropriate resources in place, and this is true for both us as data recipients, custodians, as well as the brand owners, the suppliers that we have contracts with that are going to be executing the requirements. So initially in the early stages, it included a lot of education awareness, change management. And so recognizing that takes human and financial resources to be able to implement is important, and also recognizing from the entities that are going to be implementing this that we found that they have the most success when they're also dedicated and recognizing the value in implementing it, which by and large is the case, because as we've heard from the previous two presentations, and you saw on the map that Nuran showed, this is a market trend across the world. And I think the last point, you've heard the word journey a few times. Another success driver is when there's a recognition that this isn't a one-off exercise, but it's an ongoing process, especially from the data management side, that it's not sending data once, but maintaining that data, and recognizing that, again, it's not a single deadline, but an ongoing mutual process. And I am conscious of the time, so I will hand it back over to you, Walter.
Thank you, Haley, and I know you had to kind of cut part. So again, very interesting looking at sort of the procurement side, from the country side, from the overall global look at GS1. I think we have one question in here. So it's from Anna Isabel saying, do you have experiences of implementing GS1 at project level before national level? Maybe Nuran, can you want to take that question?
Yeah, of course, I can take that. So when we talk about implementation or adoption of GS1 standards, at least what we have seen happening across around the world in many countries, is a hospital implementation. So that would be, I don't know, a national hospital or any hospital they would incorporate GS1 standards into their process. In Africa, we have South Africa as an example. They have done that. We have Netcare in South Africa. So they have implemented GS1 standards, but South Africa as a country does not have yet a national traceability system. But that's definitely in the works. But yeah, so maybe I can end there.
Okay, thank you. And so we have the one question. And again, if you should have any other questions, feel free to put them on the listserv for IPHL. And if you aren't a member, it's easy to join. And with that, I want to thank the three panelists for a lot of information and such a very interesting and important topic for all of us working in supply chain globally. And thank you again. Thank you for your time, and thank you for the panelists. And with that, I will say goodbye. Thank you.
Thank you, everyone.